So good evening to one and all. Once again welcome back to our YouTube channel NANDA Nursing Live. बेटा जो मैंने भी लाइव आसी जाइए फटाफट वीडियो को लाइक कर दियो और शेयर कर दियो, राइट ना? ओके बेटा, गुड इवनिंग टू ऑल. So question number 501 is dash is the most common and safest analgesics and antibiotics given to children. Option is digoxin, option B is acetaminophen, option C is anticholinergics, option D is benzodiazepines. So which option is the correct answer, beta? Yes, correct answer is option B, acetaminophen, right? Is the safest analgesics and antibiotics given to children. And this is commonly used for fever, headaches and other minor aches, right? So correct option is B. Next question. Question number 502 is which is an epileptic drug? Which is an epileptic drug? Option is phenytoin, option B is etomidate, option C is reformation, option D is chloroquine. So which option is the correct answer? Good evening to all. So which option is the correct answer? Epileptic drug. Etomidate, beta, this is for general anesthesia, right? This drugs for general anesthesia, GA, general anesthesia में use करा जाए. And reformation used for this is an antibiotic, beta, and bacterial infections रे दिया होची, है ना? Bacterial infection रे दिया होची. है ना? And option D जोड़ा अच्छी chloroquine कौन पे दिया होगा? Malaria पे दिया है ना? Malaria को treat करो पे दिया है. So which option is the correct answer? Option E is the correct answer. Phenytoin is an epileptic drug, right? Phenytoin is an epileptic drug. Next question, question number 503 dosaliform is a drug used in treatment of option A alcoholism, option B malaria, option C AIDS, option D mania. So which option is the correct answer? फटाफट आंसर कर दो. Dosaliform is a drug used in treatment of option D alcoholism, option B malaria, option C AIDS, option D mania. So which option is the correct answer? फटाफट आंसर करो बेटा. So correct answer is alcoholism, right? Option A is the correct answer. Very good. Option A is the correct answer. Very good. Daskatan, Sonalika, Sarla Panda, Shubhashri. So option A is the correct answer. Dosaliform is a drug used in treatment of alcoholism. Right? Option A is the correct answer. Next question, question 504. Which of the following drugs will be administered to treat anaphylaxis? Which of the following drugs will be administered to treat anaphylaxis? Option A is sodium bicarbonate, option B is epinephrine, option C is atropine, option D is digoxin. So which option is the correct answer for these questions? Most important MCQ बेटा, फटाफट आंसर कर दो. वेरी गुड जसकेतन, सोनालिका, बहुत बढ़िया. ऑप्शन बी इज द करेक्ट आंसर. एपिनेफ्रिन, राइट? एपिनेफ्रिन इज द फर्स्ट एंड मोस्ट इंपोर्टेंट ट्रीटमेंट फॉर एनाफाइलैक्सिस, राइट? एनाफाइलैक्सिस में कौन दिया हुआ है बेटा? एपिनेफ्रिन दिया हुआ है, राइट? Next question. Question number 505 रचो बेटा. Which one of the following is a second line drug for tuberculosis? Which one of the following is a second line drug for tuberculosis? Option A rifampicin, option B ethambutol, option C amikacin, option D isoniazid. So which option is the correct answer? फटाफट आंसर कर दे. No बेटा, no 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 no. amikacin होगा बेटा, amikacin. Option C is the correct answer, right? This antibiotic used for beta second line drug for tuberculosis. amikacin IV दिया हुआ बेटा, right? MDR TB मल्टी ड्रग रेजिस्टेंट TB रे दिया होची बेटा. Second line drug for tuberculosis MDR TB multi drug resistant tuberculosis. multi drug resistance tuberculosis, right? Option C is the correct answer beta. 15 milligram per kg दिया हुआ बेटा, 15 milligram per kg amikacin दिया हुआ for the treatment of MDR TB. Next question, question number 506. Which of the following symptoms should be watched for a patient receiving a loop diuretic? Which of the following symptoms should be watched for a patient receiving a loop diuretic? Option A increased blood pressure, option B weak irregular pulse, option C restless and agitation, option D paresthesia. So which option is the correct answer? Which of the following symptoms should be watched for a patient receiving a loop diuretic? फटाफट आंसर कर दो. Very good, just Ketan. So option B is the correct answer, weak irregular pulse, right? So hypokalemia हबो बेटा, loop diuretic जितने patient receive करते हैं hypokalemia हुई, right? And it cause weak and irregular pulse, muscle weakness हबो, patient को fatigue हबो, right? बुझी पल्ला ना? यदि hypokalemia होची ताहले कौन हबो? weak irregular pulse हबो and muscles weakness हबो and fatigue मध्य हबो, right? So option B is the correct answer. So loop diuretic नौथिले हमको मॉनिटर करने को पड़े पोटेशियम, हाँ ना नहीं, पोटेशियम लेवल को मॉनिटर करने को पड़े. मने रखी था पोटेशियम लेवल जदि लूप डायरेटिक्स नौसी इंजेक्शन लाइसिक्स फ्रूसामाइड नौची ताहले पेशेंट्स रो पोटेशियम लेवल को हमको मॉनिटर करने को पड़े काहे कि हाइपोकैलेमिया हे जे पेशेंट्स को हाइपोकैलेमिया हुए and hypokalemia hele patient weak irregular pulse muscles weakness and fatigue hoba beta, right? So Sanjukta Santosh, good evening. Next question, question number 507 achi. Which one of the following analgesics drug lacks anti-inflammatory actions? Which one of the following analgesics drugs lacks anti-inflammatory actions? Option A pyroxicam, option B ibuprofen, option C diclofenac sodium, option D paracetamol. So which option is the correct answer? Which option is the correct answer? Which of the following analgesic drugs lacks anti-inflammatory drugs? Anti-inflammatory actions. Option A. अरे यार तुम लोग ना दिमाग का दही करते हो भाई. Which one of the following analgesics drugs lacks anti-inflammatory actions, lacks. बेटा पायरोक्सिकैम, ibuprofen, डाइक्लोफेनेक सोडियम रे सब एंटी इन्फ्लेमेटरी प्रॉपर्टीज अच्छी, एंटी इन्फ्लेमेटरी एंड एंटी कोआगुलेटरी प्रॉपर्टीज अच्छी, आना नहीं बाकी पैरासीटामोल को छाड़ी देले, आना नहीं दिस इज लैक्स ऑफ एंटी इन्फ्लेमेटरी एक्शंस नहीं पैरासीटामोल अच्छी की बेटा एंटी इन्फ्लेमेटरी एक्शंस अच्छी. So option D is the correct answer ना, option D is the correct answer. NSAIDs कुछ है ना, NSAIDs नॉन स्टेरॉइडल एंटी इन्फ्लेमेटरी कुछ है ना. भूली जाओ ना कौन non-steroidal anti-inflammatory drugs, ibuprofen, diclofenac sodium, naproxen sodium. So option D is the correct answer, right? Next question number 580. Meditation is an example of pain management by option E NSAIDs. NSAIDs से भी कहले पूरा non-inflammatory. कौन कहले बेटा? This is non-inflammatory. Non-steroidal. Non-steroidal anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, right? Then option which is pharmacological measures, option which is opioids, option D is non-pharmacological measures. So which option is the correct answer? Meditation is an example of pain management by NSAIDs, pharmacological measures, opioids. Then option D is non-pharmacological measures. So which option is the correct answer, beta? Very good, option D is the correct answer, non-pharmacological measures. Without medication, that is without medications रे आमे जदि pain management करूँ that is non-pharmacological measures. Next question number 509 अछि. Intraosseous drug administration is typically used for children. Intraosseous drug administration is typically used for children. Option A is critically ill under age 6. Option B is critically ill and over age 6. Option C is under age 6. Option D is over age 6. So which option is the correct answer? Intraosseous drug administration typically used for children. Critically ill under age of 6. Critically ill under age of 6. Very good. Option A is the correct answer. Option A is the correct answer. Next question number 510. Which is the most important drug in the treatment of organophosphate poisoning? Which is the most important drug in the treatment of organophosphate poisoning? Option A is diazepam, option B is N-acetylcysteine, option C is adrenaline, option D is atropine sulfate. So which option is the correct answer? Most important MCQ, right? Already I am discussing corresponding sub questions. And which option is the correct answer? Very good. Option D is the correct answer. But option D only correct answer, right? Next question. Question number 511. Who discovered the antibiotic penicillin? ये डिस्कवर करते पेनिसिलिन एंटीबायोटिक पेनिसिलिन को who discovered the antibiotic penicillin? आंसर करो फटाफट. Who discovered the antibiotic penicillin? Who discovered the antibiotic penicillin? Option A Alexander Fleming, option B Edward Jenner, option C Waxman, option D none of each. So correct answer is option A Alexander Fleming. Very good, Alexander Fleming. Next question, question number 512. Which drug is preferred in urinary and genital infections? Option A norfloxacin, option B pefloxacin, option C ofloxacin, option D ciprofloxacin. So which option is the correct answer? Beta, which option is the correct answer? फटाफट आंसर कर दे लो. Which drug is preferred in urinary and genital infections? Right. Correct answer is ofloxacin. Right. Option C is the correct answer. Very good. Option C is the correct answer. Next question. Question number 513. Antibiotics are completely ineffective against. Antibiotics are completely ineffective against. Option A amoebiasis, option B virus, option C bacteria, option D microbes. So which option is the correct answer? So antibiotic specifically designed to target, kill what beta? Bacteria. Antibiotic designed for kill bacteria, not what? Not work on virus, not work on virus. Right? So antibiotics we target and kill to bacteria. We target and kill to bacteria with the help of antibiotics. Not, this is not work on viruses, right? Option, which option is the correct answer? So correct answer is option B. Right, option B is the correct answer. Next question, question number 514. People with mechanical valves requires taking this medication lifelong. People with mechanical valves require taking this medication lifelong. Option A antipyretics, option B analgesics, option C anticoagulants, option D antibiotics. So which option is the correct answer, beta? So correct answer is anticoagulants, right? People with mechanical valves require taking this medication lifelong. It is anticoagulants, right? Anticoagulants. So anticoagulants, mechanical heart valves कौन करे बेटा? रिस्क ऑफ ब्लड क्लॉट फॉर्मेशन करवार चांस थाए से पे हमको कौन करवार अछि. सो टू प्रिवेंट थ्रोम्बोएम्बोलिज्म पई हमको एंटीकोआगुलेंट्स नवा को पड़िबो, राइट? सो लाइफ लॉन्ग हमको एंटीकोआगुलेंट्स नवा को पड़िबो, right? Anticoagulants like warfarin, right? Warfarin नवा को पड़े. Next question, question number 515. 0.45% saline in an example of 0.45 saline in an example of isotonic solution, hypertonic solution, hypertonic solution, and hyperosmotic solution. आंसर कर दे बेटा फटाफट. 0.45 saline solution is considered which solution? Very good. Option B is the correct answer. Hypotonic solutions. This is hypotonic solution. 0.45% salination, hypotonic solution. Hypotonic solution. Right? Next question. Next question. Question number 516 is site of injection for low molecular weight heparin. Kali हम discussion करते थे LMWH. Site of injection for low molecular weight heparin LMWH. Option is IM, option is IV, option is SC, option is oral. So which option is the correct answer? फटाफट आंसर कर दो बिना भूल करेगी, बिना भूल रहे आंसर करो फटाफट 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 आंसर करो बेटा. Correct answer is, which option is the correct answer? So correct answer is option C, subcutaneous, right? Subcutaneous दिया हुए low molecular weight heparin under the skin, right? Next question, question number 517. Serum albumin level is 2.3 gram in a post-operative patient. What is route administration of albumin for this patient? Option A is intramuscular, option which is oral, option C is IV line, option which is subcutaneous. So which option is the correct answer? Albumin level is 2.3 gram in a post-operative patient. What route administration of albumin for this patient? So correct answer कौन है बेटा? Option C IV line ले दिया जो intravenously दिया हुआ, right? Intravenously administration करा हुआ, right? Option C is the correct answer. IV line ले दिया हुआ बेटा. Next question, question number 518 है route, right route and dose of injection vitamin K in newborn. Right route and dose. Most important MCQ. Right route and dose of injection vitamin K in newborn. Option is 0.1 milligram subcutaneous. Option which is 1 milligram IM. Option C is 1 gram IV. Option which is 5 milligram oral. So which option is the correct answer? Most important MCQ beta. विटामिन के कौन पे दिया हुआ है बेटा? ब्लीडिंग प्रिवेंट करवा पे विटामिन के दिया हो ना. विटामिन के डेफिशिएंसी है ब्लीडिंग हुआ इन न्यूबॉर्न्स, राइट? तो विटामिन के prevent hemorrhage, bleeding, right? So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is option B, right? Option B is the correct answer. Option B is the correct answer, right? Next question, question number 519. The most rapid absorption of insulin occurs in option A abdomen, option B arms, option C thigh, option D buttocks. जो मैंने भी लाइव देखो ना, लाइव क्लास को लाइक कर दियो. जो मैंने फर्स्ट टाइम चैनल को देखो, चैनल को सब्सक्राइब मत कर दियो. The most rapid absorption of insulin occurs in abdomen, arms, thigh, buttocks. So which option is the correct answer? The correct answer is abdomen, right? Option A is the correct answer, but option A is the correct answer. Fastest absorption occurs in the abdomen, right? And most common injection site, this is arms, thigh, and buttocks. This is the common injection sites. but insulin absorb most rapid absorption of insulin occurs in abdomen, right? Option A is the correct answer. Next question, question 520 rachi. The side effects of nitroglycerin each. The side effect of nitroglycerin each. Option A is vomiting, option B is diarrhea, option C is headache, option D is constipation. So which option is the correct answer? The correct answer is headache beta. The side effect of nitroglycerin is headache, right? Option C is the correct answer. Next question, question number 521 is a drug ending in the suffix pril is consider A. Option A is antidepressant, option B is SE inhibitors, option C is antifungal, option D is beta agonist. So which option is the correct answer beta? So correct answer is SE inhibitors, right? Option B is the correct answer. Next question, question number 522 rochi beta. Side effect of dusalform sulfate each. Side effects of dusalform sulfate each. Option A palpitation, low blood pressure, chest pain, nausea and vomiting, vertigo, thirst, flushing, headache. Option B is drowsiness, decreased LOC and altered sensorium. Option C is abdominal pain and cramping. Option D is fear to handle stressful situation. So which option is the correct answer beta? Dusalform रे बहुत गुड़े unpleasant symptoms देखिए को मिले बेटा. When alcohol patient consumed or after taking dusalform sulfate medicines, कौन देखिए मिले बेटा? Palpitations हुए, low blood pressure मध्य हुए, chest pain मध्य हुए, nausea and vomiting हुए, vertigo हुए, thirst हुए, flushing haba, headache haba, right? So option A is the correct answer. So option A only correct answer, right? Option A is the correct answer, right? This is all about the side effect of dusalform sulfate. And A सब symptoms haba beta jete bele alcoholic patients dusalform medications naba. Next question, question number 523 rachi beta. The nurse should instruct a patient who is to receive digoxin or lanoxin to report development of which of the following side effect? Option A ringing in the ears, option B alopecia, option C sign of breathing, option D sensitivity to sunlight, double vision. So which option is the correct answer? फटाफट आंसर कर दिया, ठीक है. मैं काली पढ़ी थी पूरा ये क्वेश्चंस. अरे यार तुम लोग भूल जाते हो भाई और बहनों, तुम लोग भूल जाते हो फटाफट यार. कितना बदमाश हो तुम लोग यार. डिगॉक्सिन का साइड इफेक्ट कौन बेटा? सेंसिटिविटी टू सनलाइट एंड डबल विजन है बना. Option D is the correct answer. Option D is the correct answer, right? And digoxin कौन पे दिया बेटा? The drug of choice for which issue? Digoxin, drug of choice for treating irregular heartbeat. Right? Next question, question number 524 अछि. Furosemide acts on which part of the nephron? Option A proximal tubule, option B descending limb of the loop of Henle, option C ascending limb of the loop of Henle, option D distal tubule. So which option is the correct answer? Anatomy physiology questions beta. इधर कैसे टपक गया नर्सिंग फाउंडेशन में. So furosemide acts on which part of the nephron? So which option is the correct answer? So correct answer is beta option C, ascending limb of the loop of Henle. So option C is the correct answer, right? Furosemide acts on the ascending loop of the loop of Henle. Right. Next question, question number 525. Which of the following sign and symptoms indicate salicylate toxicity? Option which is chest pain, option which is pink color urine, option which is slow pulse rate, option which is ringing in ear. So which option is the correct answer? फटाफट आंसर कर लो, फटाफट आंसर कर दो. So correct answer कौन होगा? salicylate toxicity means बेटा कौन है सेटा? Aspirin poisoning, one type of, right? Salicylate toxicity होची means aspirin poisoning, aspirin poisoning है ना? नहीं aspirin poisoning तो aspirin poisoning, salicylate toxicity also known as aspirin poisoning है ना? So hallmark sign of salicylate toxicity कौन बेटा? hallmark sign और sign, typical sign and symptoms. Hallmark signs of salicylate toxicity. Salicylate toxicity कौन हुए? Ringing in the ear हो बेटा, ringing in ears हो, ringing in ear, right? Ringing in ears, right? Option D is the correct answer. Option D is the correct answer. Next question. So यही सब जो salicylate toxicity जो हूँ बेटा hearing loss हमारा chance है, right? Hearing loss है जी वो patient रो. Next question, question number 526. Which of the following would be common indication of infiltration of a peripheral intravenous infusion? Option is cool skin, redness, and swelling around the incision site. Option B is blood return in the cannula. Option C is difficulty regulating the flow with gravity. Option D is hot and warm skin distal to the incision sites. So which option is the correct answer? Common sign of infiltrations कौन है बेटा? common sign of infiltration कौन हुए? common sign of infiltration. क्वेश्चन आउची टिके ध्यान देकी मने रखिबो ई क्वेश्चन. common sign of infiltration कौन हुए? रेडनेस हुई हाँ ना? नहीं रेडनेस रहिबो बेटा. और क्या होगा? स्वेलिंग एट द इंसेशन साइट होगा, स्वेलिंग एट द इंसेशन साइट, राइट. आउ कौन रहिबो? कूल स्किन रहिबो है ना? नहीं कूल स्किन रहिबो. एंड आउ कौन रहे? cooled skin around the area, cooled skin around the area. These all are about the common sign of infiltrations. Pain to discomfort मध्ये लागिबा, tightness रहिबा, and decreased or no blood return in the cannula ये सब जिनसा अब patient सहित. These are about pain to discomfort, right? So common indication of infiltration of peripheral intravenous infusion. So correct answer is option A, right? Option A is the correct answer. Next question. Very good, Sagarika. Infiltration, cold skin but phlebitis, warm skin. Very good. Question number 527 ଅଛି a non-opioid analgesics of the below each option ଅଛି butorphanol, option B ଅଛି naproxen, option C ଅଛି buprenorphine, option D ଅଛି pentajocins. So which option is the correct answer? Naproxen is the correct answer. This is the non-opioid analgesics, right? Non-opioid analgesics. This is for pain relief and inflammations, naproxen, right? Non-opioid and NSAID group drugs. Non-opioid and NSAIDs, non-steroidal anti-inflammatory drugs, right? So option B is the correct answer beta. ये कौन पे दिया है बेटा? For pain relief and inflammation. Pain relief, this is used for pain relief and prevent inflammation and inflammations from there, right? Next question, question number 528 rachi beta. In a patient taking high dose of acetaminophen over a prolonged period, the parameter to be monitored regularly is most important MCQ. E type ro clinical based or skill based questions सब आसीबा. In a patient taking high dose of acetaminophen over, acetaminophen means बेटा paracetamol, right? Paracetamol को acetaminophen भी कहा जाए, paracetamol और acetaminophen, right? acetaminophen को paracetamol कहा जाए, paracetamol को कहा जाए acetaminophen, right? In a patient taking high dose of acetaminophen over prolonged period, the parameter to be monitored regularly is option H GI irritation, option which kidney functions, option C liver function, option D prothrombin time. So which option is the correct answer? Which option is the correct answer beta? So हमें acetaminophen किंबा paracetamol कौन पे नहीं था बेटा? फीवर को ट्रीट करवा पाए ना, फीवर को नॉर्मल को आने पाए. सो बेसी मात्रा रे जदि हमें हाई डोजेस ऑफ पैरासिटामोल नवा ताहले कौन हवा? लिवर ऊपरे इफेक्ट पड़िबो हा ना, नहीं टॉक्सिफिकेशंस हवा ना, लिवर डैमेज हवा, हेपाटोटॉक्सिसिटी हवा ना, नहीं लिवर डैमेज हवा एंड हेपाटोटॉक्सिसिटी हवा बेटा, लिवर डैमेज एंड हेपाटोटॉक्सिसिटी हाँ ना, नहीं. So option C is the correct answer. liver functioning रे प्रभाव पड़ेगा हाँ ना, नहीं. सो हमको लिवर फंक्शन टेस्ट करिवार अछि, LFT करिवार अछि, लिवर फंक्शन टेस्ट करिवार अछि. सो which parameter to be monitored regularly कहछि, मींस लिवर फंक्शन टेस्ट को हमको लिवर फंक्शंस को ये पैरामीटर्स को हमको मॉनिटर करबा को पड़ेबो रेगुलरली. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 529 अछि बेटा. Which of the following is the main function of digitalis drug each? Which of the following is the main function of digitalis drug each? Option is maintain circulation of blood, option B is increase myocardial contractility, option C is prevent cardiac activity, option D is decrease cardiac activity. So which option is the correct answer? फटाफट आंसर कर दो. So correct answer is beta option B is the correct answer, increase myocardial contractility, right? Digitalis that teach digoxin beta, digitalis drugs that is which drug? Digoxin, and this is used to treat for heart failure and irregular heart contractions or myocardial contractility and slowing the heart rate हाँ ना, नहीं ये सब जिनस पाई हमें यूज करूचे डिजिटालिस और डिगॉक्सिन्स, राइट? ऑप्शन बी इज द करेक्ट आंसर। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 530 रे अछि, which of the following is the most appropriate route of routine administration for insulin? Which of the following is the most appropriate route of routine administration for insulin? Option is intravenous, option is intramuscular, option is subcutaneous, option is intradermal. So which option is the correct answer? So correct answer is subcutaneous. Next question, question number 531 अछि, how should a nurse administer an iron injection to an adult? Most important, very important, most important, very important MCQ. How should a nurse administer an iron injection to an adult? Option is intradermal in the forearm, option B is subcutaneous in the arm, option C is Z tract intramuscular in the gluteal muscles, option D is intramuscular in the deltoid. So which option is the correct answer, beta? Very good, very good, very good, very good. बहुत बढ़िया। जो मैंने पर्यंत वीडियो को लाइक करना, वीडियो को लाइक कर दियो, शेयर कर दियो, निज निज सांग मानक पाखु पहुंचे दियो, जेमती से माने भी हम लाइव क्लास रे जॉइन हे जिवे। एंड जो मैंने फर्स्ट टाइम चैनल को देखो ना बेटा, प्लीज 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 सब्सक्राइब द चैनल, इट्स माय हम्बल रिक्वेस्ट वन एंड ऑल। Please subscribe the channel, share the video, like the video. Please, it's my humble request one and all, beta. Please निज निज सांग मान को शेयर कर दियो, जेमती से माने भी हम क्लास रे जॉइन ही पारबे, राइट? So jet track IM injection दिया हुआ है ना, iron injection always administer using the jet track techniques रे दिया हुआ है ना, in the gluteal muscles to prevent leakage of the medication से ही पे jet track intramuscular injection दिया हुआ है, right? So option C is the correct answer, right? Option C is the correct answer. Next question, question number 532, in which of the following condition are mentholated drops contraindicated? In which of the following conditions are methylated drops contraindicated? Option is low back ache, option B is sprain, option C is osteoarthritis, option D is broken skin. So which option is the correct answer, beta? Mentholated drops are used for pain relief. हाँ ना, used for pain relief. Mentholated drops are generally used for pain relief in condition like low back ache, sprain and osteoarthritis, right? को थे हमें को कंडीशन रे हमें यूज करछे फॉर पेन रिलीफ, osteoarthritis, sprain आना नहीं, एंड लो बैक एक रे यूज करछे। But this is contraindicated in which? Broken skin. Option D is the correct answer. हाँ ना, option D is the correct answer. Next question, question number 533, which of the following is the preferred site of intramuscular injection in infants? इटा तो आउस बेटा मोस्ट इंपोर्टेंट एमसीक्यू बार बार पचाउछि प्रत्येक टी एग्जाम रे हैला। which of the following is the preferred site of intramuscular injection in infants? आंसर कर दो फटाफट, फटाफट आंसर कर दो, मते आंसर करबा पड़ोनी जेमती। ऑप्शन सी इज द करेक्ट आंसर। नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 534 अछि, which drug should kept in the ward when give magnesium sulfate to the client? very very important MCQ, बहुत बार हमें डिस्कशन करी सारे ए गोटे क्वेश्चंस को। which drug should keep in the ward when given magnesium sulfate to the client? ऑप्शन ए रही प्रोटामिन सल्फेट, ऑप्शन बी कैल्शियम ग्लूकोनेट, ऑप्शन सी नैलेक्सोन, ऑप्शन डी सोडियम बाइकार्बोनेट। सो मैग्नीशियम सल्फेट जदि आम पेशेंट को दौचे तो आम पाखे को मेडिसिन रखिबार अछि सो मैग्नीशियम सल्फेट रो एंटीडोट मैग्नीशियम सल्फेट टॉक्सिसिटी जदी हैला मैग्नीशियम सल्फेट पॉइजनिंग हैला ताहले हमें को एंटीडोट ता दब नहीं मैग्नीशियम सल्फेट रो एंटीडोट कोन बेटा which option is the correct answer so correct answer is which option very good option B is the correct answer so magnesium sulfate ro antidote hela calcium gluconate right calcium gluconate so magnesium toxicity hele आम पाखरे रखी थिबार अछि calcium gluconate injections right रेडी करके रखी थिबार अछि अवेलेबल थिबार अछि जदि magnesium sulfate पेशेंट को चली छी ना नहीं ताहले आम पाखरे कैल्शियम ग्लूकोनेट मेनली लेबर रूम गायनिक डिपार्टमेंट रे पोस्ट ऑपरेटिव डिपार्टमेंट रे चली थाए है ना मैग्नीशियम सल्फेट पेशेंट मानक तो आम पाखरे कैल्शियम ग्लूकोनेट अवेलेबल थिबार अछि अदरवाइज यदि टॉक्सिसिटी हैला ताहले आमे किछि करि पारबानी यदि आम पाखरे कैल्शियम ग्लूकोनेट यदि नथिबो नेक्स्ट क्वेश्चन नंबर 535 reason behind equal flow rate of solution in TPN option A to prevent electrolyte imbalance option B to prevent imbalance glucose metabolism option C to prevent fluid overload option D to prevent infection so which option is the correct answer so correct answer is beta option B is the correct answer to prevent imbalance glucose metabolism so reason behind equal flow rate of solution in TPN that is to prevent imbalance glucose metabolism right next question 536 is beta angle between the needle and skin during intramuscular injection on vastus lateralis option A is 45 degree option B is 90 degree option C is 25 degree and option D is 60 degree so which option is the correct answer so correct answer is beta option B 90 degree next question number 537 is 2 gram ciprofloxacin 2 gram ciprofloxacin prescribed to a patient in 4 doses calculating single dose 2 grams 2 grams 2 grams mean कितने बेटा 2 grams equal to 2000 what milligram ना ना तो आमे जदि चारि भाग रे जदि विभक्त करबा ताले सेपरेट करबा ताले केते हो बेटा 500 मिलीग्राम हो तो very good option A is the correct answer right next question number 538 mechanism of actions of pilocarpine in acute close angle glaucoma option is constrict pupils and increase outflow option B is dilate pupils option C is increase absorption of aqueous humor option D is increase intraocular pressures IOP so which option is the correct answer beta so correct answer is option A right option A is the correct answer constrict pupils and increase outflow the pilocarpine is a muscarinic receptor agonist that plays a key role in the managing acute angle closure glaucoma by mechanism actions induce pupil constrictions right next question number 539 is beta doctor prescribed 10 ml medication to a patient how much teaspoon the nurse gives to the patients doctors prescribe 10 ml medications to a patient how much teaspoon the nurse give to the patient so one teaspoon equal to कितने ml 1 teaspoon equal to 5 ml on नहीं जदि डॉक्टर प्रेस्क्राइब करछंती 10 ml ताहले हमें केते दबा केते टीस्पून दबा 2 teaspoon equal to 10 ml. So option B is the correct answer. Option B is the correct answer. Next question, question number 540 maximum dose for intramuscular injection. Option is 2 ml, 3 ml, 5 ml, 10 ml. गत काली तम मान को कही थी बिना भूल करिक आंसर कर. गत काली भाई आपण मानू कही भाई भौणी माने आंसर कर बिना गलती करेगी. मैक्सिमम डोज फॉर इंट्रामस्कुलर इंजेक्शन ऑप्शन ए रही 2 ml, ऑप्शन बी 3 ml, ऑप्शन सी 5 ml, ऑप्शन डी रही 10 ml. माय डियर नर्सिंग ऑफिसर बिना भूल करके आंसर कर दे प्लीज. मोस्ट इंपोर्टेंट एमसीक्यू ये सब क्वेश्चंस पचारिबा सिंपल सिंपल क्वेश्चंस बट यदि हमें जानि नथिबा हम पे डिफिकल्ट हाँ ना. सो करेक्ट आंसर इज 5 ml. वेरी गुड. 5 ml इज द करेक्ट आंसर. 5 ml is the maximum volume for single intramuscular injection. बुझी पल्ला. Next question, question number 541. The patient with increased intracranial pressure, ICP, a patient with increased intracranial pressure is receiving mannitol. To evaluate the effectiveness of this drug, the nurse should assess the client for which of the following. Option is decreased pulse rate, option is increased temperature, option C is increased urine output, option D is increased papillary reaction. So which option is the correct answer? So which option is the correct answer? So mannitol is the osmotic diuretic, right? Mannitol is the osmotic diuretic. Mannitol is the osmotic diuretic, and this is used to reduce. This is used to reduce what? Intracranial pressure. ICP, intracranial, used to reduce intracranial pressure. So very good. Correct option is option C, increased urine output. को हमको काउंट करार ची, assess करार ची. As a nurse, you should assess the client for increased urine output, right? तो हमको urine output को assess करार ची. Next question, question number 542 is the reason for using parenteral route to administer medication includes. The reason for using parenteral route to administer medications includes. Option is parenteral medication have a longer duration of action than an oral medications. Option B is it is least expensive method. Option C is it is the least expensive methods. Option D is the parenteral route allows more rapid absorption than the oral route. So which option is the correct answer? The correct answer is option D. Right? Option D is the correct answer. The parenteral route allows more rapid absorption than the oral route. Right? The reason for using parenteral route to administer medications include the parenteral route allows more rapid absorption than the oral route. Right? Option D is the correct answer. Next question, question number 543. Most medications error occurs when the nurse. Option is if caring for too many clients. Option B if fails to follow routine procedures. Option C if administering unfamiliar medications. Option D if responsible for administering numerous medications. So which option is the correct answer? Five rights of drug administration. Five rights of drug administration. Right patient, then right dose, then right time, then beta ଆଉ କ'ଣ ଅଛି right drug and right what route. This is the 5 rights of drug administration, right now. So which option is the correct answer? Option B is the correct answer, beta. Most medication error occurs when the nurse if fails to follow routine procedures. Option B is the correct answer. Right, option B is the correct answer. Next question, question number 544. The nurse selects routes for administering medications according to. The nurse select routes for administering medications according to. Option A is hospital policy. Option B is the prescriber's orders. Option C is the type of medications order. Option D is the client size and muscle mass. So which option is the correct answer? Correct answer is beta the prescriber's orders, right? The nurse select routes for administering medication according to prescriber's orders, means doctor's orders. Right, option B is the correct answer. Prescribers ki beta, prescribers is the doctors na. Option B is the correct answer. Next question, question number 545. Lactulose 20 gram is to be administered to a patient through gastric tube. On hand, lactulose syrup 10 gram for 15 ml. How much will be the nurse give? 10 gram per 15 ml. हमको एडवाइस है केते एडमिनिस्ट्रेशन करबा पे 20 ग्राम एडवाइस है तो केते हो बेटा? फॉर्मूला जाने छ ना, डोज इक्वल टू desired dose by amount in hand into volume, आना नहीं? हमारा जो फॉर्मूला है हिसाब रे 20 by 10 into 15, आना नहीं? करेक्ट आंसर केते हो? 30, आना नहीं? हाँ आमे जदि लेमन पीपल हिसाब रे करले भी 10 ग्राम जदि 15 है 30 ml इक्वल टू 20 ग्राम अब हाँ ना नहीं, किंतु हमारा फॉर्मूला हिसाब रे कैलकुलेशन करले भी 30 ml हबो. सो ऑप्शन डी इज द करेक्ट आंसर, राइट. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 546 रे अछि पेशेंट विथ कंजेस्टिव हार्ट. ऑप्शन विच टैकीकार्डिया, ऑप्शन सी nausea and vomiting, ऑप्शन डी इज gynecomastia. So which option is the correct answer? सो करेक्ट आंसर कौन है बेटा? फटाफट आंसर कर दिया. करेक्ट आंसर इज nausea and vomiting बेटा. Right, option C is the correct answer. Next question. Nausea, vomiting, anorexia, abdominal pain. How beta? This is all about the digital toxicity. Earliest manifestation of digital toxicity. Nausea, vomiting, anorexia, abdominal pain. Right. Next question, question number 547. Increased levels of thyroid releasing. Option A hyperthyroidism, option B is thyroid cancer, option C is tetany, option D is hypothyroidism. So which option is the correct answer? Increased levels of thyroid releasing. So correct answer is hyperthyroidism. Hyperthyroidism is the correct answer. Increased level of thyroid. hyperthyroidism. Next question, question number 548. Change medication administration. Stat means option is given immediately, option is give before meals, option is give after meals, option is give every day. So which option is the correct answer? फटाफट आंसर कर देला. So correct answer is give immediately, right? In medication administration, start means give immediately. Option A is the correct answer. Next question. Question number 549 is DOTS therapy. DOTS therapy category 1 is provided for the period of option which is 6 months, option which is 7 months, option C which is 8 months, option which is 9 months. So most important MCQ beta. Most important MCQ. DOTS therapy or category 1, DOTS therapy of category 1 is provided for the period of, फटाफट आंसर कर देला, कितने मास जाए दिया हुए बेटा DOTS therapy for the category 1. कैटेगरी 1 फॉर न्यू केसेस, मुझे पता ना ट्यूबरकुलोसिस कैटेगरी 1 को मन को दिया हुए फॉर न्यू केसेस ऑफ पल्मोनरी ट्यूबरकुलोसिस. जो डॉट्स थेरापी फॉर कैटेगरी 1 को मन को दिया हुए न्यू केसेस ऑफ pulmonary tuberculosis, right? So correct answer is 6 months. Very good. Option A is the correct answer. मन रखता भूल भाल करेबनी एग्जाम रे, राइट? यदि क्वेश्चन आसिला. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 550 रे अछि. Metronidazole is commonly used to treat, option A is typhoid, option B is cholera, option C is dysentery, option D is diarrhea. So which option is the correct answer? आंसर करो फटाफट. मोस्ट इंपोर्टेंट MCQ एटा भी. Metronidazole is commonly used to treat, option A is typhoid, option B is cholera, option C is dysentery, option D is diarrhea. केमते भूल भोलिया क्वेश्चन टा ना, बोल बोले हाँ. So which option is the correct answer? आंसर कर दे बेटा. So correct answer is option C बेटा. Option D हवा ना, option C dysentery पाही दिया हुए metronidazole is commonly used to treat dysentery and this is caused by entamoeba histolytica. Entamoeba histolytica. Right? Option C is the correct answer. Metronidazole is commonly used to treat dysentery and it is caused by entamoeba histolytica. Option C is the correct answer. Next question, question number 551. 1 ml of injection psilocin contains, 1 ml of injection psilocin contains, option A is 5 milligram, option B is 50 milligram, option C is 10 international unit, option D is 5 millimeters. So which option is the correct answer? So correct answer beta option C, right? 10 international unit. So psilocin केमते prepare करा हुआ है बेटा? 1 ml contain 10 units of oxytocin and 1000 ml of 0.9% normal saline or ringal lactate, right? Psilocin केमते prepare करा जाए? 1 ml or 10 international unit of oxytocin, right? With 1000 ml of 0.9% sodium chloride or normal saline right, or ringal lactate, right. So 1 ml of injection psilocin contains 10 international units, right. Next question, question number 552 is a first line medication for pulmonary tuberculosis. Option A is capromycin, option B is pyridoxine, option C is rifampicin, option D is ethanamide. So which option is the correct answer? Which option is the correct answer? Answer कर दो फटाफट. If first line medication for pulmonary tuberculosis, the correct answer is option C. Rifampicin is the first line medication in treatment of pulmonary tuberculosis, right? Rifampicin is the first line medication in the treatment of pulmonary tuberculosis, that is TB. Rifampicin mane rakhe tha beta, most important MCQ. So first line medication for pulmonary tuberculosis is the rifampicin, right? Rifampicin is the first line medication for the treatment of pulmonary tuberculosis, TB. So option C is the correct answer. Next question, question number 553 rachi. Which of the following drugs is the antidote for magnesium toxicity? एबे आमे डिस्कशन करथिले, आंसर कर दिया फटाफट. आउ मु क्वेश्चन आंसर कहबे, right? Which of the following drugs is the antidote for magnesium toxicity? Option A is calcium gluconate, option B is vitamin K, option C is naloxone, option D is hydralazine. So which option is the correct answer? फटाफट आंसर कर दे, फटाफट आंसर करो बेटा, फटाफट. Magnesium toxicity, calcium gluconate, right? Option A is the correct answer. हाइपरमैग्नेशियमिया और मैग्नीशियम टॉक्सिसिटी रे हमें कैल्शियम ग्लूकोनेट दौचे, है ना? ऑप्शन ए इज द करेक्ट आंसर. नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 554 अछि. द नर्स recognize that digitalis preparation promote diuresis should evaluate patient for a depletion of, option is phosphate, option is calcium, option C is sodium, option D is potassium. So which option is the correct answer? So correct answer is beta potassium. ହେଲା, potassium depletion है कि hypokalemia हबो, लो पोटेशियम लेवल हबो, है ना? सो हमको पोटेशियम को मॉनिटर करबा को पड़ेगा. पोटेशियम डिप्लीटेशन हबो ताको हमको इवैल्यूएट करबा को पड़ेगा, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 555 और 555. क्लोरोक्विन एक्सिबिट एक्शंस. ऑप्शन है एंटी फंगल, ऑप्शन है एंटी माइबिक, option C is anti-malarial, option is antiviral. So which option is the correct answer? आंसर कर दिया फटाफट. आंसर करो बेटा फटाफट, आंसर कर दिया फटाफट. Very good, very good, very good. समझता हूँ जाना. Chloroquine exhibit actions, that is malarial, anti-malarial, right? Anti-malarial actions to prevent and treat malaria. I don't know. Next question, question number 556 rachi. Which of the following is the drug of choice for chemoprophylaxis against rheumatic fever? Which of the following is the drug of choice for chemoprophylaxis against rheumatic fever? Erythromycin, benzathine, penicillin. Option C is procaine, penicillin. Option D is penicillin fifth. So which option is the correct answer? So benzathine, penicillin is the correct answer. Benzathine, penicillin is the correct answer. Option B is the correct answer. Next question, question number 557. Which of the following is a antidote for acetaminophen poisoning? Option A is N-acetylcysteine, option B is defuroxamine, ऑप्शन सी चे फियोस्टेगमिन ऑप्शन डी रे डिजीज इवेंट सो मोस्ट इंपोर्टेंट एमसीक्यू क्वेश्चन आसी सारे ची एक क्वेश्चंस ହେଲା एसिटामिनोफेन ର पॉइजनिंग हेले हमें को मेडिकेशंस देबा एसिटामिनोफेन पॉइजनिंग और पैरासिटामोल पॉइजनिंग को एंटीडोट आमे दवा NAC N acetylcysteine दवा बेटा राइट N acetylcysteine दवा पैरासिटामोल पॉइजनिंग और एसिटामिनोफेन पॉइजनिंग रे राइट ऑप्शन ए इज द करेक्ट आंसर मोस्ट इंपोर्टेंट एमसीक्यू मन रखता हो राइट Question number 550 is ophthalmic medication should be instilled at option is lower conjunctival sac most important MCQ ये सब जिन हमको जाने थे ना ताहले हमें ना नर्सिंग ऑफिसर पर ऑप्थाल्मिक मेडिकेशन शुड बी इंस्टिल्ड एट ऑप्शन इज लोअर कंजक्टिवल सेक ऑप्शन विच इज द कॉर्निया ऑफ द आई ऑप्शन इज अपर कंजक्टिवल सेक ऑप्शन विच द एज ऑफ द आई सो व्हिच ऑप्शन इज द करेक्ट आंसर सो करेक्ट आंसर इज द लोअर कंजक्टिवल सेक राइट ऑप्थाल्मिक मेडिकेशन शुड बी इंस्टिल्ड एट लोअर कंजक्टिवल सेक this is the commonest and safest site for installing eye drops or ointments right eye drops or ointments pulling down the lower eyelids then lower conjunctival sac रे हमको instill करने को पड़े next question number 559 अच्छे to decrease bradyarrhythmia in children during endotracheal intubation succinylcholine is given along with option अच्छे Xylocaine option which adrenaline option C रे vancomycin option रे atropine sulfate एटा आंसर कर देला which option is the correct answer so correct answer is atropine sulfate right atropine sulfate is commonly administered to counteract succinylcholine induced bradycardia in children during endotracheal intubations right so option D is the correct answer but next question number 560 which of the following drug is used for the treatment of nocturnal enuresis most important MCQ beta which of the following drug is used for the treatment of nocturnal enuresis option is amiframine option B chlorpromazine option C trazodone option D sertraline so which option is the correct answer beta which option is the correct answer so correct answer is amiframine is a tricyclic antidepressant right tricyclic antidepressant and this is the treatment of this is used in the treatment of nocturnal enuresis or कौन कहते nocturnal enuresis को बेटा nocturnal enuresis को कौन कहते bed waiting कहते bed waiting कहती है ना नहीं bed waiting तो correct answer है amiframine right nocturnal enuresis को ट्रीट करने पाई को ड्रग यूज करा जाए amiframine is the drug of choice for bed waiting or nocturnal enuresis next question number 561 an intrathecal injection administers a drug through the option is superficial vein option which is knee option C is cardiac area and option D is spine so which option is the correct answer an intrathecal injection administration of a drug through the spinal cord option D is the correct answer spinal cord within the spinal cord within the spinal cords intrathecals with the space within the spinal cord रे हमें direct inject करूचे drugs को right? So option D is the correct answer. Next question, question number 562 Rachit. Tetracycline is used as prophylaxis for. Tetracycline is used for prophylaxis for leptospirosis. Option B is brucellosis. Option is cholera. Option is meningitis. So which option is the correct answer? So correct answer is beta option C, cholera. So tetracycline is used for cholera, है ना, cholera prophylaxis. Next question, question number 563 अछि. Which of the following is considered as an indication for administering serum albumin? Option A, formation of WBC. Option B, maintenance of oncotic pressures. Option C, formation of RBC. Option D, clotting of blood. So which option is the correct answer beta? Which option is the correct answer? Answer कर दियो फटाफट. The correct answer is maintenance of oncotic pressures, right? Serum albumin is administered to maintain, restore oncotic pressures within the blood vessels. So option B is the correct answer. Right now, option B is the correct answer. Next question, question number 564. The most common adverse effects of chemotherapeutic drug is option A, constipation. Option B, frequent diarrhea. Option C, nausea and vomiting. Option D, painful mouth sore. So which option is the correct answer? Chemotherapy, most common adverse effects of chemotherapy drugs. Most common adverse effects of chemotherapy drugs. CINV. Chemotherapy induced nausea and vomiting. CINV, chemotherapy induced nausea and vomiting. So option C is the correct answer. But the most common adverse effects of chemotherapeutic drug is nausea and vomiting, right? Next question, question number 565. Which of the following is the reason for intradermal injection to be used for testing allergic reaction? Option A, it is less painful. Option B, it is easy to administer. Option C, it diffuses rapidly. Option D, it diffuses slowly. So which option is the correct answer? So correct answer is option D, it diffuses slowly. Option D is the correct answer. Next question, question number 566. The purpose of anti-embolism stocking is to, option A, promote warmth in the legs. Option B, decrease the arterial circulation to the legs. Option C, reduce or prevent edema of legs. Option D, decrease the venous circulation from legs. So which option is the correct answer? So correct answer is option C here. Beta correct answer is option C here, to reduce and prevent edema of legs, right? The purpose of anti-embolism stocking is used to prevent blood clots and reducing slow swelling in the legs. So option C is the correct answer. Option C is the correct answer. Beta option C is the correct answer. So option C only correct answer. Next question, question number 567. Which route of drug administration provides a rapid response in a patient? Which route of drug administration provides a rapid response in a patient? Option A, oral. Option B, intramuscular. Option C, sublingual. Option D, subcutaneous. So which option is the correct answer? Which route of drug administration provides a rapid response in patients? So correct answer is sublingual. But option C is the correct answer. Sublingual administration. This is the place the drugs under the tongue. Place the drugs under the tongues. Right? And this is rapidly absorbed in the bloodstream. Next question, question number 568. Beta. Patient with heart failure is on diuretics, which is the accurate indicator of such patient's health status. Option which is vital sign, option which is urine specific gravity, option C which is fluid intake and output, option which is weight. So which option is the correct answer? Patient with heart failure is on diuretics, which is the accurate indicator of such patient's health status. Option which is vital signs, option which is urine specific gravity, option which is fluid intake and output, option which is weight. So which option is the correct answer? फटाफट आंसर कर देला, फटाफट आंसर कर दे बाबू. So correct answer is beta weight, right? A patient with heart failure is on diuretics, which is the accurate indicator for such patient health status. Weight. Weight is the most accurate indicator of heart failure patient's health status when patient on diuretics, right? So option D is the correct answer. Next question number 569 freshly prepared ORS most important MCQ बेटा ये सब MCQ आसीबा बेटा मो बहुत गुडा MCQ तमन को हाईलाइट करछि important and crucial MCQ in our Maha marathon classes रे बहुत गुडा MCQ मो तमन को हाईलाइट करछि से सब तमन अपकमिंग OSSC nursing officer exam by helpful hobo. So freshly prepared ORS solution, oral rehydration solution should be used within option which is 6 hours, option which is 12 hours, option which is 48 hours, option which is 24 hours. So which option is the correct answer beta? So which option is the correct answer? According to UNICEF and WHO, prepare ORS or solution should be used within 24 hours. Option D is the correct answer. Used within 24 hours according to UNICEF and WHO. So prepared ORS solution should be used within the 24 hours. तापर आमे या को डिस्कार्ड कर देबा बेटा एंड फ्रेश बैच को फ्रेश पैकेट को यूज करके प्रिपेयर करबा है ना नहीं. Next question number 570 method used to give haloperidol injections. Most important MCQ. Method used to give haloperidol injections. Most important MCQ. Haloperidol injections. Option A jet drug, option B MEM drug, option C N drug, option D W drug. Very good. Ananda Das, Sarala Panda, Suryanarayan Pati, Sanju Merik, Sagarika, Pujananda, Jaskatan Chinda, Suryanarayan Pati, Sagarika. Very good beta. Option A only correct answer. Jet drug intramuscular injections, right? Jet drug intramuscular injections, right? So option A is the correct answer, right? Option A is the correct answer. Next question number 571. A nurse keeps in mind while giving heparin injection to a patient. Option A, do not aspirate and do not massage. Option B, do aspirate and do not massage. Option C, do not aspirate and do massage. Option D, do aspirate and do massage. Most important MCQ. When a nurse giving heparin injection, nurse keeps in mind while giving heparin injection to a patient. Which option is the correct answer beta? So heparin injection हमें केमती दोचे heparin injections? Heparin injections, route of administration, subcutaneous दोचे ना heparin injections, right ना? So avoid aspirations and massage, है ना? So avoid aspiration and massage. So option A is the correct answer. Don't aspirate and don't massage. कहीं ना हमें subcutaneous injection दोचे heparin injections. Right, option A is the correct answer. Beta next question number 572. maximum dose of atropine can be given each. Maximum dose of atropine can be given each. Most important MCQ is सब silly questions, but most important MCQ. Maximum dose of atropine can be given each. Option is 1 milligram, option is 3 milligram, option is 5 milligram, option D is 10 milligram. So which option is the correct answer? So correct answer is beta option B, 3 milligram, right? 3 milligram is the correct answer, right? Option B is the correct answer. Next question. So maximum total dose हमें 3 milligram दवा बेटा बुझी पल्लो तो as per the standard protocol हमें 0.5 to 1 milligram dose intravenously every 3 to 5 minutes, right? 0.5 to 1 milligram हमें dose IV, right? Every 3 to 5 minutes रे, right? So up maximum up to maximum कितने में देवा? up to maximum total dose होची 3 milligram, right? So maximum dose of atropine can be given is 3 milligram. Option B is the correct answer. Next question, question number 573. Patient has a sudden reaction following medicines administration. Each type of option is anaphylactic reaction, option which is septic reaction, option C is side effect, option D is none. So which option is the correct answer beta? Answer कर दे. Patient has a sudden reaction following medicines and administration is a type of option is anaphylactic reactions, option B is septic reaction, option C is side effect, option D is none. So which option is the correct answer? Very good. समझते हैं. Answer के लिए option A, anaphylactic reaction. The patient has sudden reaction following medicines administration is a type of anaphylactic reaction. So option A is the correct answer, right? Next question. Adrenaline used for dental anesthesia is. Adrenaline used for dental anesthesia is. Option A रची 1:1 lakh. Option B रची 1:10,000. Option C रची 1:2 lakhs. Option D रची 1:100. So which option is the correct answer beta? So which concentration of adrenaline is used in dental anesthesia beta? So correct answer is option A, 1:1 lakh. 1:1 lakh concentration of adrenaline is used in dental anesthesia. मने रखता है बेटा, ठीक मने रखता बेटा, ठीक ना, right? Next question देखिए. Question number 575. Which medicine used to increase the effect of local anesthesia? Option A is epinephrine, option B is norepinephrine, option C is atropine, option B is dobutamine. So which option is the correct answer? So correct answer is option A, epinephrine beta. Epinephrine is used with local anesthesia to increase the effectiveness of prolonged duration and reducing bleeding at the injection site, right? So epinephrine is the correct answer. Next question, question number 576. The drug used to prevent aspiration and decrease the secretion is option is atropine, option which is adrenaline, option C is norad, option D is dopamine. So which option is the correct answer? The drug used to prevent aspiration and decrease the secretions. Most important MCQ beta. 5-star questions. The drug used to prevent aspiration and decrease the secretion is option is atropine, option which is adrenaline, option C is norad, option D is dopamine. So which option is the correct answer? The correct answer is option A beta, atropine. Atropine, the drug is used to prevent aspiration and decrease the secretions, right? So option A is the correct answer. Next question, question number 577. Patient complaining visual disturbance. Nurse knows that this side effect occurs due to option is lithium, option B is pyrazinamide, option C is rifampicin, option D is ethambutol. So which option is the correct answer? So correct answer is ethambutol beta, right? Option D is the correct answer. Ethambutol कौन कर बेटा इट कॉज विजुअल डिस्टर्बेंस है ना परमानेंट विजन लॉस कर दो बेटा एथाम्बुटल परमानेंट विजन विजन लॉस कर दो एथाम्बुटल So option D is the correct answer. Next question, question number 570. Which is the long-acting insulin? Which is the long-acting insulin? So option A is glargine, option B is NPH, option C is regular, option D is lispro. So correct answer is option A, glargine. Glargine is the long-acting insulin. Glargine is the long-acting insulin, right? Next question, question number 579. Which among the following is an excitatory amino acid receptor antagonist? Option A रची phencyclidine, option B रची quisqualate, option C homocysteine, option D रची kyanite. So which option is the correct answer? So correct answer is option A, phencyclidine. Phencyclidine or PCP is a dissociative anesthetics. This is the dissociative anesthetic. Beta, this is a dissociative anesthetic, right? And this is act as an excitatory amino acids receptor antagonist, right? Next question, question number 580 रही बेटा. Mannitol is an example of low diuretic. Option D osmotic diuretic. Option C potassium sparing diuretic. Option D carbonic anhydrous inhibitors. बेटा किसी समय पूर्व मु कहिथिले mannitol विषय टिक आंसर कर दियो. जो मैंने सुनिथिलो निहाते भाबरे आंसर कर परबो राइटली विदाउट रॉन्ग रे आंसर कर परबो. आंसर कर दियो. वेरी गुड. ऑस्मोटिक डायूरेटिक ना आम पढ़ी कि समय मु कही पर मानिटल विषय जो आसला. वेरी गुड, भल मन रखिछ. ऑप्शन बी इज द करेक्ट आंसर. ऑस्मोटिक डायूरेटिक्स, राइट? मानिटल इज एन एग्जांपल ऑफ ऑस्मोटिक डायूरेटिक्स. नेक्स्ट क्वेश्चन, क्वेश्चन 581 which antitubercular drug can use hearing loss? Which antitubercular drug can cause hearing loss? Which antitubercular drug can cause hearing loss? Option which is streptomycin, option which is ethambutol, option C is isoniazid, option D is all of the above. So which option is the correct answer beta? So correct answer कौन बेटा? Streptomycin. This is antitubercular drugs. ये कौन करे बेटा? It can cause hearing loss, right? Can cause hearing loss and permanently damage कर दो बेटा, hearing loss कर दो. वेस्टिबुलर सिस्टम को पूरा डैमेज कर देवो एंड हियरिंग लॉस कर देवो बेटा, राइट? स्ट्रेप्टोमाइसिन एंटी ट्यूबरकुलर ड्रग्स. राइट, एंटी ट्यूबरकुलर ड्रग्स can cause hearing loss. Streptomycin, option A is the correct answer, right? Next question, question number 582. Drug of choice in heart failure. Option A is digoxin, option B is ADR, adrenaline, option C is noradrenaline, option D is KCl, potassium chloride. So which option is the correct answer? Answer करो फटाफट आंसर कर दो. एटा भी हमें पढ़िथिले किछि समय पूर्व मु कहिथिले ए क्वेश्चंस रो आंसर विषय रे. Digoxin of choice is the drug of choice in heart failure is the drug digoxin, right? Drug of choice in heart failure is digoxin, right? Digoxin is the drug of choice of heart failure, हाँ ना नहीं? So option A is the correct answer. But next question, question number 583 रे अच्छी ये रहा आपकी स्क्रीन पर. Question है prescription 125 milligram atropine available 500 milligram in 2 ml, how many amount should give to a patient by 1 ml syringe have 40 dots? Option A is 15 dots per 0.5 ml. Option B is 20 dots per 0.5 ml. Option C is 25 dots per 0.4 ml. Option D is 40 dots per 0.6 ml. So which option is the correct answer? आंसर करो बेटा। ऑप्शन बी इज द करेक्ट आंसर। केमती हैला? कैसे हुआ? फर्स्ट कौन करवा बेटा? तुम टी कहि दोछि कैलकुलेशन करी कहबा। फर्स्ट हमें कौन करबा? एट्रोपिन सॉल्यूशन रो और एट्रोपिन इंजेक्शंस रो कंसंट्रेशन बाहर करबा, राइट? सो कंसंट्रेशन बाहर करबा पय कोन अछि बेटा फार्मूला? हैला हमको देछि अवेलेबल सॉल्यूशन केते? अवेलेबल सॉल्यूशन केते अछि बेटा? 500 मिलीग्राम in 2 ml concentration, 2 ml concentration, हाँ ना नहीं? So हमको बाहर करवा को जदि हेले concentration amount of drug divided by volume of solutions, कहते हैं बेटा 500, this is 15 not 55, 500 milligram, 500 milligram divided by 2 ml equal to कहते 250 milligram per ml। मैं per ml पाई गले, हाँ ना नहीं? हमको दी थिला कहते अवेलेबल थिला 500 मिलीग्राम इन 2 ml थिला, तो हमको बाहर करवा थिला 1 ml रे केते मिलीग्राम कंसंट्रेशन, केते माने 1 ml रे केते कंसंट्रेशन रहउची, केते ड्रग पोटेंशियलिटी अच्छे, राइट? इगला 250। देन वॉल्यूम नीडेड, हमको वॉल्यूम नीडेड कितने वॉल्यूम दरकार, वॉल्यूम नीडेड तार फॉर्मूला बाहर करवा प्रेस्क्राइब्ड डोज डिवाइडेड बाय कंसंट्रेशन, है ना नहीं? कंसंट्रेशन। सो कहते प्रेस्क्राइब डोज केते प्रेस्क्राइब है बेटा 125 मिलीग्राम डिवाइडेड बाय 250 मिलीग्राम, है ना नहीं? इक्वल टू केते आसी जेबा बेटा 0.5 ml आसीबो, है ना नहीं? देन नंबर ऑफ डॉट्स हमको एबे कैलकुलेट करबा को पड़िबो, है ना नहीं? सो 1 ml syringe have 40 dots, right? 1 ml syringe रे केतेटा डॉट अछि? 40 डॉट्स, है ना नहीं? 40 डॉट्स हैला। तो नंबर ऑफ डॉट्स हम यदि काढिबा, नंबर ऑफ डॉट्स काढिबा ताहले वॉल्यूम नीडेड into number of dots by volume syringe, right? 20 dots आसीबा बेटा हैला। तो करेक्ट आंसर कौन हबो? 20 dots per 0.5 ml, right? Option B is the correct answer, right? Right now, next question of 584, which among the following statement are valid about propoxyphene? So option A, analgesics equivalent to oxycodone, option B is antagonist at mu receptors, option C is can cause diarrhea, option D is seizures at overdose. So which option is the correct answer beta? The correct answer is option A, analgesics equivalent to oxycodone, right? So option A is the correct answer beta. Next question. Sorry. Option A is the correct answer, right? Next question, question number 585, which is administering vitamin B6 along with the TB drugs for what purpose? Option A is to treat optic neuritis, option B is to prevent peripheral neuropathy, option C is to treat TB disease, option D is to enhance effectiveness of TB drugs. So which option is the correct answer? फटाफट आंसर कर दो. The correct answer is beta option B, to prevent peripheral neuropathy, right? तो विटामिन B6 दिया हुआ बेटा ट्यूबरकुलर ड्रग्स, एंटी ट्यूबरकुलर ड्रग्स सहित विटामिन B6 दिया हुए टू प्रिवेंट पेरिफेरल न्यूरोपैथी पे हैला विटामिन B6. सो विटामिन B6 रो अलगा ना कोन बेटा? पायरिडॉक्सिन्स. Other name of vitamin B6 is pyridoxines, है ना? नहीं एंटी ट्यूबरकुलर ड्रग्स सहित याक दिया हुए टू प्रिवेंट पेरिफेरल न्यूरोपैथी पे. सो मेनली आइसोनियाजिड एक बेटा पेरिफेरल न्यूरोपैथी करते हैं. आइसोनियाजिड tubercular drugs, anti-tubercular drugs. This is create peripheral neuropathy. This causes isoniazids causes peripheral neuropathy. Peripheral neuropathy. Right? तो यार ठो रक्षा पाइबा पय यार साइड इफेक्ट हैला आइसोनियाजिड रो साइड इफेक्ट दैट इज पेरिफेरल न्यूरोपैथी. ए मेडिसिन रो रक्षा पाइबा पय हमको विटामिन B6 दवा को पड़छे along with एंटी ट्यूबरकुलर ड्रग्स, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 586 रचे बेटा, व्हिच ऑफ द फॉलोइंग इज नॉट इंक्लूडेड इन 5 राइट्स ऑफ ड्रग एडमिनिस्ट्रेशन? ऑप्शन ए राइट क्लाइंट, option which is right drug, option C is right dose, option D is right environment. So which option is the correct answer? फटाफट आंसर कर दो. Which option is the correct answer? बिना भूल करके कर दियो आंसर. Very good. Jaskatan Chinda, Shuman Mange, Pradeep Tagoda, Sagarika, Girish Mahapatra, right environment. Very good. Option D is the correct answer, right environment. This is not included in 5 rights of drug administration. Next question, question number 587, which one is not a dopaminergic pathway? Which one is not a dopaminergic pathway? Option A thalamocortical pathway, option B is nigrostriatal pathway, option C is mesolimbic pathway, option D is tiberoinfundibular pathway. So which option is the correct answer? So correct answer is option A beta, thalamocortical pathway, right? Thalamocortical pathway, option A is the correct answer. So dopaminergic pathway कौन बेटा? dopaminergic pathway and nigrostriatal pathway, this is the dopaminergic pathway. Then mesolimbic pathway, this is also the dopaminergic pathway, and tiberoinfundibular pathway, this is also the dopaminergic pathway, right? And thalamocortical pathway, this is not a dopaminergic pathway, right? Next question, question number 588, all of the following are example of opioid analgesics except option A ketorolac, option B morphine, option C codeine, option D tramadol. So which option is the correct answer? So correct answer is beta, ketorolac is not an example of opioid analgesics, right? So this is used for short-term management, so moderate to severe pain को मैनेज करवा पाई हमें केट्रोलेक दौचे, हाँ ना नहीं? बुझिपारल तो नेक्स्ट क्वेश्चन क्वेश्चन नंबर 589 আছে which of the following is not a parenteral route of administration of drug option হচ্ছে intravenous option which is subcutaneous option it হচ্ছে intramuscular option which is rectum so which option is the correct answer beta which option is the correct answer आंसर कर दे बेटा फटाफट the correct answer is option D very good option D is the correct answer which of the following is not a parenteral route of administration of drug that is a rectum right next question question 592 which of the following is not the solid form for administration of drug by oral route option is enteric coated tablet option which is caplet option C is elixir option D is capsule so which option is the correct answer which option is the correct answer फटाफट answer कर दे so correct answer is elixir and elixir is a clear sweetened liquid oral dosage from the contents of active drug dissolved in mixture of water and alcohol and this is aromatic elixir antihistamine elixir so option C is the correct answer next question question number 591 dioxin should not be administered if heart rate most important MCQ beta very important very important 6 star दे दिली dioxin should not be administered if heart rate option is less than 60 beats per minute option B is more than 60 beats per minute option C is less than 80 beats per minute option D is more than 80 beats per minute so which option is the correct answer आंसर कर दे फटाफट आंसर कर दे बेटा very important MCQ बेटा यही सब क्वेश्चन का आसबो तो मानकर एग्जाम रे very important so which option is the correct answer so correct answer is option A less than 60 bits per minute hello standard guidelines अच्छी बेटा जदि less than 60 bits per minute अच्छी ताले we are not given to the patients if heart rate is less than 60 bits per minute right in adults so first assess the patient's heart rate then we provide the drugs or administer the drugs right option A is the correct answer if the heart rate less than 60 beats per minute we should not given the digoxin next question question number 592 which of the following is not a LMWH option is enoxaparin option which deltaparin option C is warfarin option is revifarin so which option is the correct answer warfarin is not a LMWH right option C is the correct answer warfarin is not a LMWH low molecular weight heparin enoxaparin deltaparin revifarin these all are LMWH except warfarin next question question number 593 which of the following is not a chain breaking antioxidant which of the following is not a chain breaking antioxidant option is uric acid option which is superoxide dismutase option C is alpha tocopherol option C is ceruloplasmin so which option is the correct answer so correct answer is beta option B superoxide dismutase it is an enzyme right it is an enzyme beta that catalyzes the dismutation of the superoxide radical into oxygen and hydrogen peroxide so option B is the correct answer beta next question question number 594 achi actions of drugs explained by the principle of competitive enzyme inhibition is demonstrated by all of the following except option is isoniazid option B is methotrexate option C is sulfonamides option D is British anti-leucite so which option is the correct answer the correct answer is beta option D is the correct answer British anti-leucides BAL it is also known as dimercaprol it is also known as कौन कहते बेटा आओ कौन कहते this is dimercaprol it's also known as dimercaprol and this is chelating agent beta this is chelating agent right this is chelating agent and used to treat heavy metal poisoning. This is used to treat heavy metal poisoning. Used to treat heavy metal poisoning. Right? Heavy metal poisoning रे याको यूज करा जाए. Right? So option D is the correct answer. Next question, question number 595 is core body temperature can be measured using all of the following method except option is oral, option which is rectal, option C is temporal artery, option D is esophageal. So which option is the correct answer, beta? So correct answer is option C is the correct answer. Core body temperature can be measured using all of the following methods except temporal artery, right? Oral core body temperature measure करी हेबो, rectal रे करी हेबो, esophageal करी हेबो, right? Except option C को छाड़े के, right? Next question, question number 596 अच्छी बेटा. A patient is developed mild urticaria and breathlessness. Option. A patient is developed mild urticaria and breathlessness. Which of the following medicine would not be prescribed for this patient at this time? Option is chlorpromazine. Option B is hydrocortisone. Option C is chlorpheniramine. Option D is dexamethasone. So which option is the correct answer, beta? So correct answer is chlorpheniramine. So option C is the correct answer. In patient who develop mild urticaria and breathlessness, chlorpheniramine should not be prescribed. Right? Option C is the correct answer, beta. Next question, question number 597. Which statement is suitable for ranitidine or Rantac? Which statement is suitable for ranitidine or Rantac except? Option A, side effect of Rantac is diarrhea. Option B, confusion develop with Rantac. Option C, taken with antacids. Option D, smoking affect the action of Rantac. So which option is the correct answer? So correct answer is beta option C, taken with antacids, right? Rantac should not be taken with antacids, right? Ranitidine should not be taken with antacid, right? So option C is the correct answer, beta, because antacid can interfere with the absorption of ranitidine and reducing the effectiveness of ranitidine, right? And Rantac side effect beta diarrhea, vomiting, confusion, ये सब है Rantac side effect, right? So option C is the correct answer. Next question, question number 598. Which of the following drugs should not be used in a patient with renal failure? Option is spironolactone. Option B is furosemide. Option C is sodium bicarbonate. Option D is chlorothiazide. So which option is the correct answer? Which of the following drugs should not be used in a patient with renal failure? So correct answer is spironolactone. Spironolactone should not be used in patient with renal failure because spironolactone is a potassium sparing diuretic. Potassium sparing diuretic, right? And it can increase the potassium level in the blood. It can increase the potassium level in the blood, right? Say पे हमें दबा नहीं बेटा. And kidney patient already failure रे अच्छी, kidney failure रे अच्छी, and potassium and already failure रे अच्छी, और से impaired to excrete potassium, है ना नहीं? So स्पाइरेनोलेक्टोन देला पर कौन हो हाइपरकेलेमिया हाइपरकेलेमिया हो ना बढ़ी जीव पोटेशियम लेवल इन द बॉडी रे पोटेशियम लेवल बढ़ी जीव एलिवेटेड हो पोटेशियम लेवल हाँ ना नहीं इट कैन लाइफ थ्रेटनिंग कंडीशन फॉर द पेशेंट्स बेटा सो स्पाइरेनोलेक्टोन आमे दबा नहीं नेक्स्ट क्वेश्चन नंबर 599 एस्पिरिन इज यूज्ड इन ऑल ऑफ द फॉलोइंग कंडीशन एक्सेप्ट ऑप्शन लीजिए माइकेडल इन्फेक्शंस ऑप्शन बी रे कोलोरेक्टल कैंसर ऑप्शन सी रे लिवर कैंसर ऑप्शन डी स्ट्रोक सो व्हिच ऑप्शन इज द करेक्ट आंसर बेटा व्हिच ऑप्शन इज द करेक्ट आंसर so correct answer is option C beta so aspirin is used all of the following condition except so main reason aspirin is not given to liver cancer patient है ना नहीं because already liver impaired है liver disease अच्छी liver cancer patient छाड़ी करी है ना नहीं aspirin is used all of the following condition except liver cancer so option C is the correct answer next question number 600 अच्छी बेटा Prior to administration of antibiotics, there is needed to sensitivity test. Which of the following antibiotic is not required sensitivity test? Option A metronidazole, option B meropenem, option C cefoperazone, option D amoxicillin. So which option is the correct answer? According to medical guidelines, को antibiotics को हमें बिना सेंसिटिविटी टेस्ट रे आमे एडमिनिस्ट्रेशन करी परिबा फटाफट आंसर कर दला फटाफट आंसर कर दो फटाफट तो करेक्ट आंसर है मेट्रोनिडाजोल राइट मेट्रोनिडाजोल इज द करेक्ट आंसर राइट मेट्रोनिडाजोल इज द करेक्ट आंसर बेटा जो मैंने ये पर्यंत वीडियो को लाइक करना फटाफट वीडियो को लाइक कर दे एवं शेयर कर दे एवं जो मैंने फर्स्ट टाइम चैनल को देखो प्लीज सब्सक्राइब द चैनल राइट नेक्स्ट क्वेश्चन नंबर 601 रही बेटा Why ADTA is not suitable for calcium estimation? Why ADTA is not suitable for calcium estimation? Option A, it will destroy calcium. Option B, binds the calcium which is needed for coagulation. Option C, calcium concentration will increase. Option D, all of these. So which option is the correct answer? So correct answer is all of these. Beta option D is the correct answer. ADTA is not suitable for calcium estimation. It will destroy calcium, bind the calcium which is needed for coagulation. Calcium concentration will increase. So all of these above option D is the correct answer. Next question number 602. Which of the following is not an anti-epileptic drug? Which of the following is not an anti-epileptic drug? Option A carbamazepine, option B jonissamide, option C sodium valproate, option D acetaminophen. So which option is the correct answer beta? Which option is the correct answer? So carbamazepine is anti-epileptic drug, right? This is anti-epileptic drug, right? कौन पे यूज हुई है for partial this is used for partial सीजर पे यूज करा हो कार्बामाजेपाइन को यूज करा हो पार्शियल सीजर पे राइट जोनिसामाइड कौन पे यूज कर दिस इज आल्सो एंटी एपिलेप्टिक ड्रग्स and this is used for adjunct therapy. This is used for then sodium valproate. This is also anti-epileptic drugs. And this is the broad spectrum anti-epileptic drugs, and this is used in various types of seizures. So different types of seizures पे use करा जाए. Hello. Acetaminophen, this is not an anti-epileptic. This is analgesics and antipyretics. Analgesics and antipyretics. This is analgesics and antipyretics, and this is used for pain and fever. This is used for pain and fever. This is used for pain and fever, right now? So which option is the correct answer? So correct answer is option D. Option D, this is not an anti-epileptic drug. Next question number 603, which is not an analgesic drug? Option is acetaminophen, option which is fentanyl, option is propofol, option is ketorolac. So which option is the correct answer? So correct answer is propofol. Option C is the correct answer. This is the anesthetics agent. This propofol is the anesthetics agent. agent है ना नहीं anesthetics agent. This is not a analgesic drugs. This anesthesia for sedation में use करे जाए anesthesia for sedations right. Next question number 604 है intraosseous root exclude option है distal tibia option which is proximal tibia option which is median clavicle option which is femur. So which option is the correct answer? फटाफट आंसर कर दिला इंट्राओसियस रूट एक्सक्लूड नॉट इंक्लूड एक्सक्लूड. तो करेक्ट आंसर इज ऑप्शन सी राइट. ऑप्शन सी इज द करेक्ट आंसर. Intraosseous root exclude the median clavicle. So option C is the correct answer. Next question number 605 which all of the following COVID-19 symptoms in the child except option which is shock, option which is purulent conjunctivitis, option which is fever, option which is rhinitis. So which option is the correct answer beta? Correct answer is beta option A shock right. So COVID-19 symptoms कौन कौन बेटा fever cough COVID-19 symptoms है fever cough और कौन बेटा shortness of breath है ना sore throat right and fatigue. These all are about the symptoms of COVID-19 right. COVID-19 are symptoms and shock is not a symptoms of COVID-19 in children right. Next question number 606 streptomycin should not be given by mouth but by injection because option H it is not absorbed when given by mouth, option B it can injure the gastric mucosa, option C it produces more adverse effect when given by mouth, option D it is not effective when given by mouth. So which option is the correct answer? So option A is the correct answer. It is not absorbed when given by mouth right. So streptomycin is not absorbed by the gastrointestinal tract right. So it is not absorbed when given by mouth. So option A is the correct answer. Next question number 697 the patient admitted to the ward had 3 episodes of vomiting. Which of the following drugs should not be given? Option A fentanyl, option B promethazine, option C tramadol, option D ondansetron. So which option is the correct answer? So correct answer is beta tramadol. So tramadol is an opioid analgesic right. This is an opioid analgesic. So the patient admitted to the ward had 3 episodes of vomiting. Which of the following drugs should not be given? So tramadol दवा ने tramadol दिले कौन हवा कहला author nausea vomiting हवा right. So option C is the correct answer. Question number 608 is with injection morphine is given intrathecal during procedure for pain relief. After procedure, which of following analysis you will not administer? Injection morphine is given intrathecal during procedure for pain relief. After procedure, which of the following analysis you will not administer? Option is paracetamol, option B diclofenac, option C tramadol, option D fentanyl. So which option is the correct answer? So correct answer is beta option D right. Option D is the correct answer. This is avoid in post-operative pain relief because fentanyl is a synthetic opioid beta. So option D is the correct answer right. So administer कला पर opioid toxicity हमारा chance था and main complication कौन हवा बेटा respiratory depression हवा बेटा main complication is respiratory depression हवा main complication जदि हमें fentanyl दे दिलता है respiratory depression हवा respiratory depression हवा respiratory depression हवा. This is the main complication of fentanyl right. So option D is the correct answer beta. Next question number 609 lignocaine Lignocaine and adrenaline not used for repair of injury to digitalis because option which adrenaline cause vasoconstriction of blood vessels supplying digitalis which may lead to decreased tissue perfusion and necrosis. Option which adrenaline decreases the effect of lignocaine. Option C which adrenaline causes systemic effect. Option D which adrenaline causes vasodilation which may lead to increased bleeding. So which option is the correct answer beta? So correct answer is which option? So correct answer is option A. Adrenaline causes vasoconstriction of blood vessels supplying digitalis which may lead to decreased tissue perfusion and necrosis. Option A is the correct answer. Next question, question number 100, 610. Ringal lactate solution contains all of the following constitute except option A which is chloride, option which is sodium, option C which is potassium, option which is glucose. Most important MCQ. Right? So which option is the correct answer beta? कौन था बेटा? कैल्शियम क्लोराइड था, कैल्शियम क्लोराइड था, लिंगर लैक्टेट कौन कौन रोचे? कैल्शियम क्लोराइड, पोटाशियम क्लोराइड रोचे, पोटाशियम क्लोराइड रोचे बेटा, राइट। आउ कौन रोचे? सोडियम क्लोराइड रोचे, सोडियम क्लोराइड रोचे, है ना? नहीं, सोडियम लैक्टेट, सोडियम lactate roach and water roach. These are the compositions of ringer lactate solutions, right? So which option is the correct answer? But except the ringer lactate solution contains all of the following constitute except option D is the correct answer. Option D is the correct answer, right? Next question, question number 611. Which of the following nursing interventions is not appropriate when an IV infusion infiltrates? Option is elevating the site, option which is applying warm moist compress, option which is massaging or rubbing the site, option D is immediately stopping the infusion. So which option is the correct answer? So correct answer is beta option C, massaging or rubbing the site. Which of the following nursing intervention is not appropriate when an IV infusion infiltrates? Massaging or rubbing the sites, right? So option C is the correct answer. So जदि आमे मसाजिंग एवं रबिंग करबा बेटा फ्लेवाइटिस हबो, इन्फेक्शन हबो, हाइपरवोलेमिया हबो, राइट? ये सब कॉम्प्लिकेशंस हबो, सो हमको मसाजिंग एंड रबिंग करबार नहीं, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 612 which lansoprazole is not used in which of the following cases? Option is gastritis, option B is peptic ulcer, option C is Zollinger-Ellison syndrome, option D is thalamus hypertrophy. So which option is the correct answer? So correct answer is beta thalamus hypertrophy, thalamus hypertrophy, right? So lansoprazole is a proton pump inhibitors, PPA. This is a PPI, proton pump inhibitors, and primarily used to treat excessive stomach acid and gastric ulcers यूज करछे, हाँ ना? गैस्ट्रिक अल्सर्स यूज करछे, गैस्ट्राइटिस यूज करछे, पेप्टिक अल्सर यूज करछे, एंड Zollinger-Ellison syndrome lansoprazole यूज करछे. नॉट यूज इन व्हिच ऑफ द फॉलोइंग केसेस? थैलेमस हाइपरट्रोफी आमे यूज करूना हो बेटा, राइट? नेक्स्ट क्वेश्चन, क्वेश्चन नंबर 613 अछि. Which drug is not given by subcutaneous route? Option is insulin, option B is LMWH, option is tuberculin, option D is erythropoietin. So which option is the correct answer? फटाफट आंसर कर लो. Which drug is not given by subcutaneous route? Insulin, low molecular weight heparin, tuberculin, that is कौन बेटा? tuberculin test, और कौन कहती है आपको? PPD टेस्ट कहती, PPD, tuberculin टेस्ट को अदरवाइज नोन एज PPD टेस्ट, प्यूरिफाइड प्रोटीन डेरिवेटिव. बार बार कहूँ बेटा, प्रोटीन डेरिवेटिव, प्यूरिफाइड प्रोटीन डेरिवेटिव, हाँ ना? नहीं, tuberculin test is otherwise known as purified protein derivative. Then erythropoietin, right? Insulin दिया हो बेटा subcutaneous, LMW दिया हो subcutaneous, आना नहीं, and erythropoietin भी दिया हो subcutaneously. Tuberculin test केमते दिया हो बेटा intradermal, हाँ ना नहीं, intradermal दिया हो, right? So option C is the correct answer. Option C is the correct answer, right? Option C is the correct answer. Next question, question number 614. Which of following is not an adverse effect of morphine? Option A euphoria. Option B respiratory stimulation. Option C nausea. Option D histamine release. So which option is the correct answer, beta? So correct answer is option B is the correct answer, right? Respiratory stimulation. Which of the following is not an adverse effect of morphine? Right? Morphine adverse effect कौन कौन बेटा? Euphoria, nausea, histamine release. These all are the adverse effect of morphine, right? Adverse effect of morphine. Except respiratory stimulation is not a adverse effect of morphine, right? Next question, question number 615 अच्छी बेटा. All of the following are side effect of reformation except option A dizziness, option B anorexia, option C orange color urine, option D hypertension. So which option is the correct answer? Which option is the correct answer? So correct answer is option D beta, hypertension. This is the not, this is all of are the side effects of reformation, right? Dizziness haba, anorexia haba, orange color urine haba, this all are the side effect of reformation, right? Side effect of reformation, right? Except hypertension. So option D is the correct answer. Next question, question number 616. Effect of vasodilator includes except option is hypotension, option which is hypertension, option C is diuresis, option D is sweating. So which option is the correct answer? Except, sorry, effect of vasodilator include except. Effect of vasodilator include except hypotension, hypertension, diuresis, sweating. So correct answer is beta, hypertension. Hypertension. The primary effects of vasodilators is to widen blood vessels, which decrease peripheral vascular lower blood pressures, right? So option B is the correct answer, hypertension ही हवा बेटा. Then अच्छी sign of aspirin toxicity except option here अच्छे ringing in ear of tinnitus, option which is nausea, vomiting, option C is bleeding, option which is shoulder pain. Aspirin toxicity हेले कौन हुए बेटा? Tinnitus हुए, ringing in ears हुए, हाँ ना नहीं. This is the common sign and symptoms. Ringing हवा, हाँ ना नहीं. Nausea and vomiting हवा, bleeding tendency हवा, right? Due to platelet inhibition. So co-option habo beta, option D is the correct answer. Sign of aspirin toxicity except, that is shoulder pain. Option D is the correct answer. Next question, question number 618. All are crystalloid solution except, all are crystalloid solution except option which is normal saline, option which is ringal lactate, option C 5% excess, option D is HES. So which option is the correct answer beta? HES कौन बेटा? hydroxy ethyl starch, hydroxy ethyl starch, hydroxy ethyl starch, right? HES, hydroxy ethyl starch. This is a colloid, right? This is also a colloid. No. And normal saline कौन बेटा? Crystalloid. This is crystalloid. Ringal lactate, this is also crystalloid. Okay, nahi. This is also crystalloid. 5% exposure also crystalloid. So HES is the colloid solutions, right? This is the colloid solutions. colloid solutions कौन कौन आसे बेटा? colloid solutions रे जानी छा? colloid solutions रे, colloid solutions और colloid IV fluids कौन कौन हमें देखिले? HES देखिले, हाँ ना नहीं? HES तो देखिले. आउ कौन? human ह्यूमन albumin भी असे ह्यूमन albumin जानिछ ह्यूमन albumin it is also called as हेमाक्सिल जानिछ बेटा हेमाक्सिल 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 also a called as dextran जानिछ ना dextran also a called dextran also a called these all are the colloids IV fluids but crystalloids कौन कौन normal saline ringer lactate that is RL ने RL को आउ कौन कहते बेटा Hartman's solutions कहते जाने चना RL को Hartman's solutions कहते Hartman's solution कहते ringer lactate solution or is otherwise known as Hartman's solutions, right? And 5% dextrose, these all are about crystalloids, right? Next question number 619. What is the WHO step analysis ladder scale accept? Option which is step 1 non-opioid analgesics for severe pain and persistent. Option which is step 1 non-opioid analgesics for mild pain. Option C which is step 2 weak opioid for moderate pain. Option D which is step 3 strong opioid for severe and persistent pain. So which option is the correct answer beta? So correct answer is option is step 1 non-opioid analgesics for severe pain and persistent. This is except WHO steps analgesics ladders, right? So option A is the correct answer beta. Next question number 620 rachi. The purpose of performing the arthrocentesis is the purpose of performing the arthrocentesis is option A muscles contraction, option B is synovial fluid analysis, option C is bone mass, option D is blood flow abnormality. So which option is the correct answer beta? फटाफट आंसर कर दिला which option is the correct answer? So correct answer is option B synovial fluid analysis. Arthrocentesis is the procedure performed to obtain synovial fluid within the joint for therapeutic purpose. For therapeutic purpose रे हमें को analysis करते हैं synovial fluid within the joint रो हमें obtain करता हो synovial fluid, and this is the purpose of performing the arthrocentesis, right? Arthritis, gout, septic arthritis ହେଇଥିଲେ ଆମେ ଏଇ procedure କରୁଛୁ बेटा, right? Next question number 621 is a patient develops a catheter associated urinary tract infection COTI despite adherence to aseptic insertion technique. Which of the following best explains these infections from epidemiological standpoint? Option which is endogenous transmission via ascending colonization, option which is cross transmission by health workers, option C which is contaminated catheter tip during insertion, option which is improper urinary bag positioning. So which option is the correct answer beta? So correct answer is beta option A endogenous transmission via ascending colonizations, right? Option A is the correct answer beta. Next question number 622. Which of the following is a critical step when inserting an indwelling catheter into a male patient? Option which is slowly inflate the catheter balloon with sterile saline. Option which is secure the catheter drainage tubing to the bed seat. Option C is advance the catheter until urine flows, then insert it 14 inches more. Option D is advance the catheter to the purification of the drainage and balloon ports. So answer करो बेटा फटाफट क्वेश्चन को पढ़ो and answer करो. Which of the following is a critical step when inserting an indwelling catheter into a male patient? So correct answer is option D. अब बेटा option D is the correct answer. So हमको जानने को पड़ेगा कि बेटा drainage port means urine flow out हब कुआडू and balloon port कोटा हमको जानने वाला चाहिए to secure the catheter in the bladder and separate inserting the catheter port, right? So हमको जानने वाला चाहिए. So option D is the correct answer. Next question number 623. Which is the best time to change a bowel diversion ostomy appellants, option D is after administration of fluids, option B is immediately after meals, option C is immediately after the administration of any medications, and option D is beta when the bowel is least active. So which option is the correct answer? So correct answer is beta option D. Have a correct answer. Option D is the correct answer when the bowel is least active, right? This is the best time to change bowel diversion ostomy appellants, right? Next question number 624 is CABG stand for most important MCQ. Mane rakhita यार full form. CABG stand for option which is cerebral artery bypass graft, option B is cardiac artery bypass graft, option C is cranial artery bypass graft, option D is coronary artery bypass graft. So which option is the correct answer? फटाफट आंसर कर देलो, फटाफट आंसर कर दे बेटा. Very good, very good. So correct answer is option D, coronary artery bypass graft. CABG is coronary artery bypass graft. So blockage in the patient's coronary artery, so say bypassed artery bypass graft kurchi है ना नहीं सर्जिकल ऑपरेशंस करेगी. Next question number 625, which of the following is best technique for urine sample collection in a patient who is having indwelling urinary catheter? Option is first morning specimen, option B is remove the catheter, then collect the urine and reconnect the catheter, option C is aspirate the urine from catheter port, option D is suprapubic aspiration. So which option is the correct answer beta? Which of the following is the best technique for urine sample collection in a patient who is having indwelling urinary catheter? Most important MCQ, right? This is the clinical based or skill based questions. First morning specimen, option which remove the catheter, then collect the urine and reconnect the catheter, option C is aspirate the urine from catheter port, option D is suprapubic aspiration. So which option is the correct answer beta? So correct answer is option C is the correct answer, right? Option C is the correct answer beta. So thank you so much to one and all beta जो मैंने आज का लाइव क्लास से जॉइन नहीं थिला तो मैंने बहुत बहुत धन्यवाद तहे दिल से. एंड गॉड ब्लेस टू ऑल. एटा भल भाव पाठ पढ़ाटा कंटिन्यू रहो. आमर OSSC नर्सिंग ऑफिसर एग्जाम केबे भी नोटिस जारी कर देबो, केबे भी डेट आउट कर देबो. सो हमको सी पई स्ट्रांगली प्रिपरेशन करबा को पड़िबो, राइट? यूट्यूब लाइव क्लासेस भी देखो, देन बहिरू भी पढ़ो बेटा, राइट? यूट्यूब लाइव क्लासेस देखले हेबने. मोस्ट ऑफ ऑल क्वेश्चंस आमे कवर अप करूचे यूट्यूब लाइव क्लासेस रे, बट तुम मन को बही भी पढ़िबा को पड़ो, टेक्स्ट बुक भी पढ़िबा को पड़िबो, राइट? तो थैंक यू सो मच टू वन एंड ऑल बेटा. थैंक यू सागरिका एंड गौरा पात्र. थैंक यू सो मच टू वन एंड ऑल. प्लीज बेटा वीडियो को लाइक कर दियो, शेयर कर दियो, एवं जो मैंने फर्स्ट टाइम चैनल को देखुच निहाती भाव में चैनल को सब्सक्राइब कर दियो. द्वारा मुझे आउे टी मोटिवेट होजी एवं क्लासेस करी तुम मानकर, राइट ना? एंड ये वीडियो को शेयर कर दियो जमी समस्त पाखे पहुँची पार. निज निज फ्रेंड्स मान को शेयर करो एवं सब्सक्राइब करने कहीदि. निहाती भाव में सब्सक्राइब कर देवी चैनल को, राइट? तो आजिकार क्लास रे आम एठी रहिबा. आसंता काले पुणी देखा हबो ठीक संध्या समय 6 PM रे. से पर्यंत टेक केयर एंड बाय बाय बेटा.